Hello and welcome back to the channel. My name is Dr. James Gill and you've joined me for another clinical skills video. Today we're going to be looking at how to apply an arm sling. And there are two types that we need to be aware of. There's the broad arm sling where the patient is holding their arm across their body, and then there is the elevated arm sling where the patient is going to be having the arm touching the unaffected shoulder. The important difference between the two is your broad arm sling is there for injuries to the affected arm to try to support it, prevent those getting worse. And we're largely talking about injuries to the wrist and the upper limb. We can have issues with broken ribs that this broad arm sling is also able to support. And crucially, the patient must be able to bend their elbow. By contrast, the elevated arm sling is there to try and help, again, support the arm, but to try and control bleeding that may be affecting the arm and swelling potentially as well. In terms of applying the sling, you're both using the same triangular bandage for both slings, but we have a few crucial differences. With the broad arm sling, we're going to have the patient support that arm and the sling goes underneath the affected arm to start off on the unaffected shoulder. The outer layer is then going to come up over the affected arm to tie above the shoulder on the affected side. By comparison with the elevated arm sling, we're going to start off over the top of the affected arm, again with the initial point left at the unaffected shoulder. By comparison now, we're then going to take the trailing edge of the triangular bandage around the patient's back to come up and tie a reef knot over the unaffected shoulder. So with the elevated arm sling, we're going to be tying over the unaffected shoulder, and with the broad arm sling, we're going to be tying our reef knot over the affected shoulder. And undoing the sling, we've got the long axis going down. I'm just going to feed this underneath if I might. And if you could just press that in place. Okay. And then we're going to come up and round the unaffected side, and I'm bringing this other piece around to tie in a reef knot behind the affected shoulder. And then we're going to take the corner that we've got here, bring around the excess tissue, and we're just going to twizzle this in so it comes nice and tight, and that can be pushed inside the sling itself. I'm going to make sure we've gone all the way through to the little finger, so that's covered and supported, and crucially going to check the capillary refill. So pressing for 5 seconds and relaxing, we can see it's easily coming back. And in terms of doing a high arm sling, so if you could put your arm up to your shoulder. So this time we're going to go over the top, and again the long axis of the bandage is down, so we're going to go up, and if you could just hold that there for me. We're coming up underneath the arm, and now I'm going around the patient's back and over to tie in a reef knot at the back here. Again, we're going to take the spare area that we've got here with the excess triangle. We're going to turn that in on itself, making sure everything is nice and tight, and then pushing that in. We can also pin that here, and we can check the fingers at the top. Again, 1, 2, 3, 4, 5, and we've got a normal capillary refill. And that is how to apply our two bandages. Well, I hope that's been a useful overview of the two different types of triangular bandage slings that we can use. If you've got any questions or comments, please put them down below. And with that, take care, and we'll see you in the next one. Cheerio.